A lot has been talked about when it comes to diabetes, from the need of diet adjustments, physical exercise and all that. But there is an aspect that is still left unexplored, and that is mental health. How diabetes usually affects the mental health of the people living with diabetes. Being diabetic increases by more than 30% the occurrences of most mental disorders such as depression, anxiety, psychosis, and others. My name is Lilian Mumina. I am a registered clinical nutritionist, and in today's video we're going to talk about how diabetes affects the mental health and what we can do or what you can do to help that person that you know who has diabetes. So the first thing that you need to understand is that it is okay for you to have questions like why did it have to happen to you. And one thing that people need to understand is that no one wants to harm themselves, because in most of the times when someone says they're diabetic, most people will look at you and be like, this guy or this lady is diabetic because they were eating too much. That might be the cause. They were drinking too much. That might also be the cause. They were not active physically. That might also be the cause. But it does not mean that we wanted to harm ourselves. It is an unfortunate occurrence and it should be treated like that. So what I'm trying to say is that it's not your fault that you are diabetic. And by the fact that you've clicked on this video, you are in the right space, because over here we talk about all matters nutrition and health. And we are definitely looking forward to do more on diabetes, because it is affecting and it is causing a lot of deaths, a lot of expenses to a lot of people. If you're not affected, you are infected. We all have someone we know, a relative, a friend who is struggling with this. So that is the first thing that you need to understand, that it is not your fault. It is not their fault that they developed diabetes. It might just be a bad coincidence that their genes, the environment, their diet habits, and their physical activity levels intertwined well enough for the development of these chronic disorders. Fortunately enough, for those of us who are not diabetes can be very much prevented, and studies have shown that having lifestyle adjustments reduces the occurrences of most non-communicable diseases, including diabetes, by more than 50%. That is a good number. Another way that diabetes usually affects people is because it's a whole assignment that you've actually been given. If you are a type 2, you are used to a certain way of life. Maybe you are not counting your carbs, you are not checking on what you're eating, you're just eating. When your body cannot effectively control the blood sugars, or your pancreas is not producing insulin, in case of a type 1 diabetic, you have to check on what you're eating. Is it in line with the glycemic and the insulin index of what you want to achieve from that meal? Once you're diagnosed with diabetes, there is the aspect of trying to read about it, trying to see what has worked for others, and then there's also the aspect of someone might have done this thing and they worked for them, and then you do it and it doesn't work for you. So there's a lot of learning, there's a lot of researching, there's a lot of moving about that comes with being diabetic. This again can bring about anxiety, because you can imagine having a task that you're supposed to complete and then you may be late for submission. You actually get anxious. Now imagine this person who has been diagnosed with diabetes. Now they have to be on the constant know-how. A research comes out on diabetes, most of them will feel like they need to be informed well enough on this. It's definitely a whole subject of learning on its own, and that is where we are here for you guys, because we are going to try as much as we can to relay information in the simplest language, in the simplest forms, that you guys can get the most of learning out of it. The other emotional bit of being diabetic is the aspect of continuously taking up medication or using injections. You can imagine being diagnosed with type 1 and you have a phobia of needles, and you have a phobia of maybe medication for the type 2 diabetic. Now you've just been diagnosed with a disease that requires you to have constant injections day and night for survival. To me, that can be quite heavy, and to most people it's like that, because now you have to adjust yourself, now battling with your fears, and make sure that you adjust and fast. Another thing that will predispose diabetics to mental disorders is actually the social isolation, the social outlook of diabetes. How people view people who have diabetes is very bad, because once someone tells you they have diabetic, the next thing a typical Kenyan person will think about is this person has diabetic because they eat too much. Might be the cause, but again, some sometimes just bad luck. Another thing on the social aspect is, in Kenya or in Africa, we use food as part of the social gatherings. If you are an extrovert, you are used to people, you are used to attending social events, chilling with the boys, chilling with the girls. Now this thing has to stop, or they have to reduce, or when you go to these events, you have to control the amount of food that you're going to eat. And being a typical Kenya, people will start thinking, kanajifanya hakataki kukula, unaona? Or someone will tell you you're choosy because you don't want to eat their food, and you know deep down inside you it's not your fault. It's because you have to take care of your health first, and that's okay. That's okay. Actually, in such a situation, I usually say the diabetic does not have any problem. It's the other person who has that shady outlook that has the problem, and they need to deal with their problems first. So another thing that will make diabetics have a lot of mental disorders, of course, the uncontrolled blood sugar has a lot of impact on your metabolic function. So when your metabolic function is altered, you can have sleep problems. Diabetics usually have a lot of insomnia. You get that you have a lot of fatigue. You're tired all the time, and with time this might lead up to the mental disorders. So what are some of the things that you can do if you are diabetic to prevent the occurrences of the mental disorders? The first thing that you need to do is attend those diabetic clinics. Yes, they are very important. You will get a client telling you, Mumina, it's a waste of time, they just tell me the basics. It's still very important, because you're going to go interact with others who have diabetes. It's a community that you're creating, and it will give you some social support here and there, because you're going to see other people living with the condition, other people managing their sugars effectively and well, and living comfortably, and this gives motivation. So if you're a newly diagnosed diabetic, please make an effort of going and attending those diabetic clinics religiously without fail. So the next thing that you need to do, of course, is physical exercise. Not too much, not too little, because you don't want to overwork your body, you go hypo, you're diabetic. There are things that you need to factor in before you start physical exercise or physical activity and you're diabetic. One of them is how well you're managing your blood sugars, the drugs that you're taking, and how much of the food, the nutrient intake that you take up during the day. And again, exercise is the most underrated psychotherapy we have, because it enables production and release of the good feel hormones. You're going to feel energized, happy. It uplifts your mood instantly. When it becomes a habit, I usually say if you can have an addiction, let it be exercise. Of course, before you get the rhythm of exercise, it will be like a lot of work. It will be like you're straining too much. But once you get into it, exercise is great, and it's great for controlling your blood sugars also, because you're going to increase your muscle stores, and also going to improve your insulin sensitivity if you're type 2 diabetic, better control of blood sugars. That is what we want. And apart from that, you get the mental clarity, good mood, and you also get to sleep well, because diabetics, again, they have a lot of sleep problems, from insomnia to sleep apnea, and all this disrupts the quality of rest that they are getting, and this will definitely alter and affect their moods negatively. Moderate exercise is very, very important. Taking care of your nutrition before and after workout is also very, very necessary for optimum results. If you're looking for someone to walk with you through the whole recovery process or the whole management process of diabetes, we actually tailor diet therapies and diet plans in line with your normal routines, your physical activity. We also give you recommendation on the physical activities and the physical exercises that you can do that will perform best with the diet plan that you're giving you. We also follow up, we also do checkups, and we also have supplementations for those that need it and they are diabetic. Make sure that you check us out. We promise to not disappoint. Another thing that you can do if you are diabetic and you're having issues and struggles with your mental health is actually get counseling. You've assessed yourself and you've seen that there's nothing that you're doing that is working. You still find yourself with so much anxiety, so many questions, so many worries, you're overthinking too much. It is advisable that you get someone to help you with the psychosocial support. It's actually advisable to talk to a close friend first before you can talk to a stranger. If you have someone that you trust, if you have someone that you can confide in, even when you're going to visit your dietitian, you can talk to them about your fears, your worries, or if you have a relative who has a lot of concerns on the same, you can advise them to talk to people, to talk to someone. And I always say that diabetics clinics will help you so much in that aspect. And if you can get also a psychologist or a psychiatrist to help you walk through the journey. It is not a death sentence. People live very comfortable lives with diabetes. So being an overthinker, I actually know it's almost impossible to avoid overthinking, but you can try as much as you can to limit it so that it doesn't affect or go beyond. Because when you are diabetic, you're also predisposed to all these conditions more than someone who is not diabetic. I'm not scaring anyone, I'm just telling you so that you understand better why you need to take care of yourself more. Another thing that you can do is actually watch this video where I talked about the dietary adjustments of controlling diabetes, improving insulin sensitivity through diet. And don't forget to subscribe and like so that it can spread to others who are struggling with mental health and they are diabetic. And you'll also be supporting my channel to grow, and I'll be grateful for that. Thanks for watching, and bye.